Welcome to 5MHT. In today's video you will learn signs, symptoms and treatment for fatty liver. This video does not replace the advice of a medical professional. This video is strictly for educational purposes only. The liver is your biggest inner organ. It incorporates a number of imperative capacities. The 5 major capacities of the liver include filtration, digestion, metabolism and detoxification, protein synthesis, storage of vitamins and minerals. Fatty liver disease is a condition caused by the capacity of additional fat within the liver. As the liver becomes fattier, it can cause fibrosis and cirrhosis. This is the scarring stage of liver disease. The great news is you can recover from fatty liver disease with healthy lifestyle changes. Here are the 5 signs and symptoms of fatty liver disease. Number 5. Abdominal pain. Fat can lead to inflammation in the liver cells, which can, in turn, cause the immune system to attack the tissue. The pain or discomfort that you may feel will likely be on your upper right side, just underneath your ribcage where your liver sits. Another possible reason for pain could be bile duct stones, which may have accumulated as a result of fatty liver disease. Number 4. Nausea and acid reflux. People with fatty liver have a higher prevalence of gastroesophageal reflux. They experience heartburn and belching more frequently than average. This is due to the pressure changes associated with the condition, which can lead to stomach acid being pushed up into the esophagus. It can also cause nausea and vomiting. In addition, these substances cannot be eliminated by the liver, which damages the stomach and esophagus mucosa, leading to acid reflux. Number 3. Fatigue and confusion. Many people with liver disease continue to experience fatigue despite extensive care. The culprit is often a buildup of toxins in the body that your liver isn't clearing as it should. This can cause other parts of the body and brain to become affected, which can impede concentration. You might experience brain fog or forget things as your liver gets worse. Number 2. Elevated liver enzymes. The liver is responsible for producing several enzymes to metabolize nutrients, drugs, and toxins. The main biomarkers for liver damage are AST and ALT. A study showed that 25 to 50% of fatty liver disease patients have elevated AST and ALT levels. An increase in these enzymes could be a sign of fatty liver disease. Number 1. Bleeding and bruising. The liver produces platelet, which is a type of blood cell that helps to clot to stop bleeding. When blood can't clot, it leads to bruising and bleeding. Now here are 5 things you can do to combat fatty liver disease. Number 1. Exercise. Aerobic exercise such as walking, running or even dancing are ways to improve your heart health, not only by lowering stress hormones in your system but also by reducing the fat synthesis in your liver. Both heavy and resistance training have been shown to have benefits for fatty liver disease, so make sure you incorporate both into your workout regimen. Number 2. Lose weight. Losing even just 5% of your body weight can lower the fat in your liver. Dropping around 10% or more will help keep infrared injury to liver cells at a minimum, as well as helping to reverse some of the damage done due to inflammation in your body. Try to lose weight gradually. 1 to 2 pounds per week will be best for your health and progress. Number 3. Avoid or limit alcohol consumption. Drinking alcohol causes fat accumulation in the liver. When alcohol is broken down in the liver, an enzyme converts ethanol to a toxic compound called acetaldehyde. Acetaldehyde is carcinogenic, meaning it can turn into cancer-causing substances. Number 4. Try a Mediterranean diet. The Mediterranean diet has always been touted for its benefits for those with fatty liver disease. However, the diet's daily recommendations focus on healthy fats, antioxidants, fiber, and complex carbohydrates, which can help you lower your levels of fat in your liver. Number 5. Avoid foods with extra sugar. Fructose and sucrose leads to the development of NAFLD. They showed how these sugars can lead to fat buildup in the liver over time. Some examples are cakes, cookies, pastries, candy, ice cream, sugary cereals, and soft drinks. Remember, we only have one life and one body. Take care of it so in return, it will take care of you. Leave us your comments and suggestion. We'd love to hear from you. If you like this video, please like, subscribe and hit the bell for us, so you'll get notifications for our future uploads. Thanks and stay well.